Well, it is 3 p.m. and I would like to go ahead and get started. I want to say welcome to our community forum. And today we're going to talk about the hardest hit and COVID-19. On behalf of Advocates for Community Wellness, I want to extend a big thank you to all of you who have joined us today. I know in the middle of a hot summer afternoon, there might be a few things you can do, not many, right? But we thank you for joining us as we hear and learn a lot about something that is so important, especially right now. And the team is very excited to bring this information to you and to our community. We want to give special recognition to our keynote speakers today, who are Dr. Christopher Howard and Ms. Regina Hopkins. And Advocates for Community Wellness is very proud to engage on the Zoom platform as we extend our reach and help our community to grow in learning as well as to prosper in health and wellness. I'm Lynette Mahone, and I am the Community Engagement Director for Advocates for Community Wellness. Just to give you a little background about me, I am a mother of 2 and a grandmother of 2 beautiful grandsons. I am the owner of LKC Spa Spectacular and also LKC Health and Wellness. I'm a certified lifestyle coach for the CDC program for diabetes prevention for type 2 diabetes, as well as a facilitator for COPD sessions. I do have an MBA from Indiana University, and I am retired of 30 years from the steel industry. But most importantly, I want to say that I am a Christian and I believe in promoting health and wellness, and I am very privileged to be on the team with this magnificent organization that Dale Kane started, Advocates for Community Wellness. On this call, you have our full leadership team. Our executive board is represented. As I just mentioned, our founder and executive director is Ms. Dale Kane. Regina Hopkins, who will be one of our keynote presenters today. She is our health education director. We have Ms. Demetria Jett that did an outstanding job pulling all of this presentation together. She's our administration and health educator. Again, I'm Lynette. And Dr. Christopher Howard, he is our mental health educator director. So that's who we are. So again, I mentioned earlier that this is pretty new to us on Zoom. This is our second time being on Zoom. So we're learning, and maybe this might be the first time that some of you have participated on a Zoom session. So if we stumble a little bit, we all can forgive each other, but I do want to point out a few features just to make sure that you're aware of how this works. If you look at your box on the right-hand side, you should see your beautiful face or you'll see your name. If you see a microphone with a line through it, that means you are on mute. If you see a video camera that has a line through it, that means that you are not on camera. One thing that I would suggest is when you are on Zoom or any other feature that enables a camera feature, always assume that we can see your beautiful face. So whether or not you switch screens to look at your email or if you want to check out our Facebook while we're talking, just know that your camera is always on and we can see you. There is a mute and an unmute button. So if you want to say something, you can scroll over your name and ask to unmute, or I believe you might be able to unmute yourself if I'm not mistaken. At the bottom, there is a chat symbol. If you want, you can click on that, and I am going to send everyone a message saying thank you for joining. So You'll see that in the chat section. If you have a question, I encourage all of you to use the chat and we will respond. All right, I'm getting responses. All right. So again, a little bit about the organization. Ms. Dale Kane started the organization in 2003, and it is a 501c3 not-for-profit local organization. We're grassroots, and it is faith-based. It's Christ-centered, and we promote health and wellness, and also we discuss a lot about disease prevention. The great thing about the organization is we serve the community, and our mission is to serve the public through health promotion, education, through fitness, nutrition, and healthy lifestyle programs. But the great thing is we go beyond the walls of the church, and that's exactly what you'll see today. So again, it's not just in the church walls, even though that is of utmost importance and priority for us as well. But we believe that the more people we can reach, the more impact we can have. It's where we live, it's where we work, it's where we play, it's what we do all the time. So again, we want to promote health and wellness, advocates for community wellness. We believe in prevention, and we also believe that we can affect all generations. We advocate for physical, spiritual, and mental wellness because it all works together for being completely well. And lifestyle and nutrition. Nutrition really is the core of our bodies, and what we put in is what we're going to get. So we talk a lot about nutrition, and Dale actually has a lot of classes for cooking. It's not just for middle age or seniors. We do things for adolescent and children because, again, we're talking about generations, and we also have wellness at work programs. So now I have the pleasure of bringing to you our founder and executive director, Ms. Dale Kane.
Hello, I'm Dale Kane once again, and I'm so pleased that you have chosen to join us today for our virtual community forum, The Hardest Hit, COVID-19. I've worked in the health promotion and wellness industry for over 20 years, and I have seen so much suffering, challenges, and not enough of support at the local level to address chronic health diseases that can lead to serious illnesses and premature deaths. The impact of COVID-19 has placed a spotlight on the ongoing health conditions and chronic disease that have existed in our families, our communities for years, yet many times they go unaddressed. And now the state of health is in front and center for those who have been affected with the virus, and many are paying the highest price, which is mortality. Here at Advocates for Community Wellness, fondly known by our team as A4CW, we are committed to our mission, educating the public on lifestyle nutrition and preventive medicine strategy. We promote the 8 dimensions of wellness: physical, emotional, social, intellectual, environmental, spiritual, vocational, and financial wellness. They all have a role in our overall health and well-being. Today, our goal is to reach out and connect, next slide, with new potential partners and community residents, as well as stay connected to our existing partner and community base. Next slide. It takes all stakeholders in society, local government, community-based organization, businesses, funders, community leaders, healthcare, and you to make a positive impact on the health of the most vulnerable population. I want to emphasize that it takes all of us to inspire and to educate the public and promote family and community health and wellness, and to reduce chronic disease risk factors in all communities, especially the people of color, which are the hardest hit population. At Advocates, we have an overarching campaign. It is creating a culture of wealth, and this is our approach to wellness. Next slide. Creating a culture of wealth is our healthy community initiative. Our 4 core areas that we outreach in our initiative is combating diabetes, overcoming heart disease, conquering cancer, and addressing mental health. These are just the core, but we also stretch over that. It's a saying that we say that anything that ails you, okay, when it comes to wellness. So we have a unique spelling of wealth, which is WELLTH, and that is whole body wellness. We take a holistic approach to wellness by feeding the mind, the body, and the spirit. They're all interconnected. E represent empowerment through education. Education is the key to our health and wellness. Is knowing and have a greater understanding what our body needs in order for it to be healthy and stay healthy. L represents lifelong learning. We're forever learning and gaining a greater knowledge about how to care for ourselves and our family, and how to incorporate all this wonderful information that's out there and is available to us, so that we can build up our temple, which is our body. The second L represents leaving a legacy, and this is a legacy of good health. Many times, well, let me say that we're all going to leave a legacy of something, and it is our hope and our goal is to help people to leave a legacy of good health, where we are having hope and healing and wellness for ourselves and our family, and that short term of any chronic condition that we may overcome ourselves, but it'll be short-lived. T represents transform your mind. Transform your mind is that we have to make a shift towards thinking about our health and our wellness. Most of us think of it just in the physical realm, but it actually starts in our mental and our spiritual realm. And those are the biggest components that contributes to our health. And H represents health, healing, and hope is in your hands. And let me say our hands. It's the things that we are doing, the actions that we take daily that's going to make a difference for ourselves and for our family and for our community. And with that being said, I'd like to introduce our first speaker, which is Regina Hopkins. She is our Director of Health Education. Thank you.
Hello, thank you so much, Dale. Can everyone hear me?
Yes.
Okay. You can go to the first slide, please. As Dale said, my name is Regina Hopkins. I am the Director of Health Education. I am also a family nurse practitioner serving on the south side of Chicago. A little bit about myself. I have been working in the medical field for 14 years. About 5 years ago, I received my master's in nursing science to practice as a nurse practitioner in family medicine. My focus in the field of medicine is on chronic disease management. I'm also an international researcher. I've traveled to Bangkok, Thailand in 2005, conducting research in women's health, focusing on body image, self-concept, and personal health behaviors of adolescent females. In addition to that, I'm also a published author of 2 books, SALT, which is Sisters Accelerating Lives Together. It's a spiritual collection of stories of myself, as well as 3 other young women who were all victims of Hurricane Katrina. And as we share our stories of survival and faith in Christ as we navigate through life after Katrina. And also, I recently published a book. It's called As I Grow in Grace. It's a 30-day devotional and prayer guide. Next slide. Just to talk a little bit about the facts and myths about COVID-19. Of course, everyone is fully aware of what COVID-19 is, or if you're not aware, if you haven't been watching the news, It has been a drastic um, virus that has spread across the world, that has impacted and affected many lives. But we want to talk about the hardest hit individuals today, as you've seen in a lot of the news, which is the underserved communities, primarily the people of color. I have some few stats from the CDC that I want to share today. According to the CDC, there's a long-standing systematic, I'm sorry, there's a long-standing systemic health and social inequities that have put many members of the of racial and ethnic groups at risk of getting COVID. These groups primarily consist of African Americans, Hispanics, Latinos, American Indian, Alaska Natives, individuals. Each of these communities, evidence points shows that there's higher rates of hospitalizations and deaths from COVID-19 among these groups when compared to whites. As of June 12th, 2020, hospitalization rates are highest among non-Hispanic American Indians or Alaska Native and African Americans when compared to Hispanic or Latino persons. Non-Hispanic American Indian or Alaska Native persons have a rate of 5 times more likely to experience COVID-19 or develop complications than non-Hispanic whites. Non-Hispanic Black persons have a rate approximately 5 times that of non-Hispanic whites. And the Latino population also have a rate of 4 times that of non-Hispanic whites. So the question is, why are ethnic minority groups, such as the ones I named, at a greater risk of developing or coming in contact with COVID-19 or developing complications? Well, according to the CDC, they focus on 3 major areas. The first area was living conditions. For many people from the racial and ethnic minority groups, living conditions contribute to health conditions that make it harder to follow steps to prevent getting sick from COVID-19 or seeking care if they do get sick. The second component was work circumstances. Some types of work and workplace policies put workers at increased risk of getting COVID-19, and members of the racial and ethnic minority groups are more likely to work in these conditions. The third component was health circumstances. We see that health and healthcare inequities affect many racial and ethnic minority groups. Some of these inequities can put people at increased risk of getting severely ill and dying from COVID-19. Next slide. To expand on that, if we look at the living conditions, the first area we see is that many ethnic minorities are more likely to live in densely populated areas, which means because of institutional racism, those who live in densely populated areas and homes may find it harder to practice social distancing. So if you're in an overcrowded area, it's going to be difficult for you to practice the social distancing that we hear and that we're encouraged to do to prevent the spread of COVID-19. Then there's the racial housing segregation. This has been linked to health conditions such as asthma and other underlying medical conditions that put people at increased risk of getting severely ill or dying from COVID-19. Some of these communities have higher numbers of ethnic minorities and higher levels of exposure to pollution and other environmental hazards. So depending upon where you live, you may be exposed to more environmental factors that make you more ill and more susceptible to other diseases that creates further complications if you do come in contact with COVID-19. Then we also see those people who rely on public transportation. I'm sorry, I just skipped one. Those who live in reservation homes, primarily the Native American Indians, they may lack complete plumbing. And compared to the rest of the nation, when they live on the reservation, if they lack complete plumbing, they find it harder to practice the appropriate disinfection and also hand washing. So they're more susceptible of coming in contact with COVID-19. Then we see the individuals who live further away from grocery stores and medical facilities, or they lack reliable transportation. So many members of ethnic minority groups live in communities that are furthest away from grocery stores and medical facilities. They also have a hard time relying on or having reliable transportation to get to certain stores, which makes it difficult for them to stockpile on supplies that would allow for them to stay home and, prevent them from going out on a routine basis. And in a lot of the underserved communities, we see that it's even more difficult now to get to a grocery store or a pharmacy because of the recent looting and riots. I work in the Roseland community, and it's pretty devastating because a lot of the stores that were there, the few stores that were there, are now boarded up. I've had a lot of patients personally who are now having to travel across town to other neighborhoods to try to get their medications because most of the pharmacies were affected by the looting and the rioting are now closed up. So people are now having a difficult time getting prescriptions to treat their chronic illnesses in light of the COVID-19 as a result of the recent looting, because of so many stores now are boarded up and closed, as well as pharmacies are being boarded up and closed. Then we see those individuals who rely on public transportation. And we know that a lot of some members of racial and ethnic minority groups do rely mostly on public transportation, which once again makes it a challenge to practice social distancing. So if you don't have your own car, you're on a crowded bus or a crowded train, a lot of people are coming in contact with the virus, unfortunately, when they are having to travel on transportation that is overcrowded. We also see people living in the multi-generational households, which is more common amongst minority groups, African Americans and especially Latinos. You may have up to 10 people living in a 3-bedroom house. So once again, it's hard for you to protect the older individuals who may be more susceptible of developing an illness, or the children. I mean, well, everyone is at risk. But say, for example, if you had someone who did come in contact with COVID-19 and they tested positive, if you live in a small home with 10 people, it's going to be hard for you to isolate to one room without coming in contact with the other 9 individuals in the home. So that's one thing that they've noticed also, is that it's hard now to practice social distancing if a person has come in contact with COVID when you're sharing the household with multiple people. And then we also see that there is overcrowding in jails and prisons, homeless shelters, and detention centers. And we also know, once again, minority groups are higher in number in these particular facilities. So therefore, it creates an increased spread of COVID-19 because of overcrowding. Next slide. Then we look at some of the work circumstances. Of course, being an essential worker, just going back once again to minority groups, a lot of people who are working, in grocery stores, or who are working on the front lines, they are the essential workers who are now going out and are possibly being exposed. They don't have the luxury of some individuals who have a middle class or upper class job, who work in corporate America, who have the option of working from home. So most minority groups are essential workers working in the grocery stores, or in some of your restaurants, or on the front lines. They are going to be exposed. You also have individuals who lack sick leave. So not being able to take time off. If you are sick, you're sick, your immune system's down. So people tend to be forced to go to work because they need money. So they're leaving the home sick, going to work, and increasing their chances of coming in contact with the virus. Then we have, income, education, and those individuals who are jobless. So the third component is the health circumstances. Once again, going back to just minority groups, there is a distrust in the healthcare system. There's language barriers and the cost of missing work. So a lot of people may not even seek medical attention if they are ill, because of their distress and language barriers in the healthcare system. We also see that there's higher rates of chronic conditions at earlier ages in minority groups. Diabetes is definitely one that has impacted the minority population. I've had several patients who have come in contact with COVID, and many of them did have diabetes and heart disease, and many of them did suffer from complications, mainly because most of these diseases are poorly controlled. But once again, just going back to now, it makes it more difficult when people can't get to the grocery store to get the proper healthy foods. They can't get to the pharmacy to get their medications, and they already have chronic conditions that are poorly controlled. If you do come in contact with this virus, once again, you're more susceptible to getting the worst of the complications because you have an underlying condition that wasn't controlled in the first place. Next slide. Okay. And then one other thing that we've also noticed, well, I have personally noticed, is which has increased the spread of the virus. We see that it's continuing to spread despite measures that are being encouraged to take, such as wearing a mask and washing your hands. I do feel that there's a lack of a proper understanding of infection control. Many individuals, they're told to wear the mask and wash their hands. But in reality, when you think about infection control, those individuals who are in the medical field, who have a better understanding of infection control, there's courses that you take on infection control. There's proper techniques that you do to ensure that you are taking the measures to prevent infection. And it's one thing we see is the mask. And this is just a little graphic of the do's and don'ts of wearing a mask. And I see this every time I go out to the store or I'm in the public. People have the mask on their face, but not wearing it properly. So the first picture, the person has the mask on, but their nose is exposed. You know that, with any type of respiratory virus, you can breathe in the virus, you can inhale the virus through your mouth and your nose. So covering your mouth is okay, but if your nose is still exposed, you're still bound to be exposed to the virus. Then you have the person in the second picture who isn't fully covered. Only half of the mask is covering their mouth and nose. The chin is exposed. So if it's not fully covering the face, it's not really a good seal. There's still spots of leakage that if you come into contact with the virus, it can still seep through the mask. And then we have the person who just decides to wear the mask on their chin. Their nose and mouth is open. So this is doing no good at all. You might as well not even have the mask on because you're still exposing yourself. Then we have the individual who is wearing the mask properly. The mouth and the nose are both covered. It's over the ears, it's covering the chin. So there's a better seal around the face that will prevent any seepage if you're still inhaling air, any droplets from the virus itself. Another thing I also noticed I wanted to share too is you've probably also seen people talk about the use of gloves. Once again, just going back to that proper understanding of infection and control, a lot of people I do see, feel that they're going to be safe if they wear gloves out in public. But what people fail to understand is once you put on a pair of gloves, anything you touch, if the virus is on objects, you've touched it with the glove, now it's on the glove. So you're going around into the store, you touch the grocery cart, you got the virus on your hand, you pick up a food item and put it in your basket. Now the virus that you touched is on your food item, is in your cart. You touch your purse, you touch your cell phone. The glove is just pretty much picking up the virus and just spreading it around. What I try to tell people that if you're going to be out in public, you may have to make sure that you're washing your hands with soap and water for 20 seconds or using a alcohol-based 60% or more hand sanitizer between each interaction. So just think about if as a healthcare provider, I see an average of 15, sometimes 20 patients on a day. If I had on a pair of gloves for the whole entire day, and I wear that one pair of gloves for every person I come in contact with, would you really consider, me practicing good hygiene or practicing infection control if I'm using one pair of gloves for 20 people? No. And it's the same concept. You're wearing one pair of gloves to touch 20 different things. You're cross-contaminating and just spreading the virus. So I generally tell people don't even wear the gloves. Practice good hand washing. If you're touching objects After every encounter, make sure that you're washing your hands or using a hand-based sanitizer. Next slide. So everyone, regardless of race and ethnicity, there are some things that we can do to help prevent the spread. So the first thing we can do is just simply follow the CDC's guidance for seeking medical care if you feel that you have COVID-19 symptoms or have been around someone with COVID-19 symptoms. There are lots more testing sites now. A lot of places you don't even have to have a medical card to get tested. I know personally, I work at Chicago Family Health Center on the South Side. We do triage telephone visits. So if you feel the need that you've been exposed or you have symptoms, we have testing outside in a tent where you can come through in your car and get tested. So there are testing sites, for people who feel that they've been exposed to the need to be tested. Also, just follow the steps to prevent the further spread of COVID-19. If you have been sick or exposed, once again, if you feel that you have symptoms or you were exposed to someone with COVID-19, stay inside, do the 2-week quarantine. That means you have to stay inside the house, not coming out, potentially spreading the virus. Take steps to protect yourself and your community. Take precautions as to where you go to daily events. A lot of people feel the need to go out now because the city is more open. Once again, if it's not necessary, I would encourage people to stay home. Learning to cope with stress, I'm going to leave that to Dr. Howard because he's going to speak a little bit more about mental health in his presentation. And also just finding ways to connect with family and friends. This is also a mental health component. I'm going to let Dr. Howard share. Next slide. But overall tips for good health, once again, proper hand washing, like I said, washing your hands with soap and water for 20 minutes, using the hand sanitizer with a 60% or greater base of alcohol, eating a nutritious diet, especially for diabetics, a diet that minimizes high blood sugar. Studies have shown that individuals with type 2 diabetes and other metabolic disorders are at higher risk of complications, simply because once people with diabetes, once you have high glucose levels, it makes it harder to fight off any virus or infection. So the high sugar content makes it more difficult to fight off infection. So it slows down the rate in which your body fights off any type of virus or infection. Getting adequate rest. Sleep is important for your health. It also helps to boost your immune system. Also finding ways to manage stress. When you're under a lot of stress, it lowers your immune system, which makes you more susceptible to infections and diseases. And this may even mean turning off the television. I've come in contact with a lot of patients who have been experiencing depression and anxiety. I know just the vast amount of information that we see on television, the amount of deaths, the amount of illness, being exposed to that on a regular daily basis, all day, every day, creates anxiety and depression in a lot of individuals. So sometimes to manage that stress, to reduce stress on your body, to help to keep your immune system up, it may mean just turning the television off. Next slide. And also for those who smoke, smoking increases your risk of catching infections and also leads to further complications from infections. So if you are a smoker, we encourage you to seek to stop smoking. Exercising at least 4 times a week for 30 minutes. Once again, all these things are going to help to contribute to good health and also boost your immune system, so that if you do come in contact with any illness or virus or disease, your body has a better chance of fighting it off. Getting some fresh air, adequate sunshine. This leads into the next component of supplements: vitamin D, zinc, vitamin C, and garlic. Vitamin D is known as the immune boosting vitamin. From individuals who may not know, vitamin D is needed to build immunity and also needed to build and strengthen your bones. So a lot of people are deficient in vitamin D. Your body naturally makes vitamin D when you are exposed to sunlight, but a lot of individuals don't get adequate sunlight, so therefore we are deficient, especially African Americans, because our skin is darker. We don't absorb as much sunlight, so therefore we may have a tendency to have a lower vitamin D level. But taking an adequate supplement once a day, if you don't take a multivitamin, or if you're not getting a good 15 minutes of sunlight every day to allow your body to build its own and make its own vitamin D, I would suggest taking a daily supplement once a day, just to kind of help to build and boost your immunity. In addition to that, alcohol, there are studies that show that chronic alcohol consumption also increases infections. So once again, all these things not only help to boost your immune system and to combat any disease, but it also helps to promote healthy lifestyles in general. And that's all I have for today. I'm going to turn it over to Dr. Chris Howard, who's going to be speaking to you about the neurological and mental health component and its impact this impact from COVID-19. I think you're muted, Chris.
There we go. These things can be so tricky sometimes. So one of the first things I want to do is I just want to say thank you, everybody, for coming out, for joining us today, because I do think this information is very important, and hopefully we can get this information to other people in the community who may have not been able to join us. I think this is really important, and I think we can really flatten the curve. I think we could do our part to really help flatten the curve. So just a little bit about me. I recently earned my doctorate, was it July 2nd, but COVID kind of canceled the graduation because the graduation was supposed to be like October 25th in Chicago. So we got the email that they're going to try to do like an online graduation, maybe something comparable to this. So here I am. I earned my doctorate in clinical psychology with a specialization in neuropsychology with an emphasis on health disparity, cognitive aging. And I tend to focus on the African Americans. So one of the things that I wanted to discuss today is what is COVID? And Regina did such a wonderful job just kind of discussing like the nuances of this COVID-19. So next slide, please. So one of the things I kind of wanted to do is just kind of like just bring attention to it. So I'm not going to harp too much on it because we kind of covered it in the previous section. But what it is an infectious disease that is caused by severe acute respiratory syndrome, coronavirus. It was first identified in December 2019 in Wuhan, Hubei, China, and has resulted in an ongoing pandemic as of July 7th. This year, more than 11.6 million cases have been reported across 188 countries and territories, resulting in more than 538,000 deaths, which is kind of concerning because America is at 130,000. So essentially 1/5 of the deaths around the United States has happened in this country, which kind of shows that it is really something to be concerned with. But even more so than that, it appears that African Americans and Hispanics are disproportionately affected. So one of the things I wanted to kind of delve into is why. So, with some of the common symptoms is fever, cough, fatigue, shortness of breath, loss of smell and taste. And kind of like what Regina was saying, it was spread between people during close contact. Less commonly, people may become infected by touching a contaminated surface and the touching of their face. So if you think about it, how many times through the course of the day, even by accident, do you just touch your face? Perhaps you rub your nose, maybe you touch your mouth, something of the sort. You're maybe going out to get something to eat and you're rushing and you take a bite out of your sandwich and you say to yourself, oh man, I gotta wash my hands, right? It happens a little bit more frequently than we sometimes anticipate, or sometimes more than what we would prefer, but it does happen. So it's about understanding why this exists. Next slide. So one of the things, okay, that's right, we did do this. Okay, so one of the things I wanted to address was the emotional, social, and spiritual impact of COVID-19. Let me see if I can move this so I can see. Oops. Okay, there we go. So it's important because like a lot of times we talk about different things, but it's important to say, because a lot of times we say shelter in place or do different things, but it's like, how do we do it? Like, that's really an important aspect of it. So it's kind of like knowing what to do when you're sick and if you're concerned about COVID-19. So one of the things that you can do is utilize resources in your community. Contact a health professional before you start any self-treatment for COVID-19. And this is so important because a lot of times you get on social media and you see a number of memes, you see a number of posts, and you see almost as much misinformation as you do factual information. And sometimes, a lot of times, misinformation can really be dangerous, and it can only exacerbate what may already be present. So it's really good just to say, okay, well, who's my healthcare provider? Who's my physician? Who's whomever in my community that I can contact in order to receive accurate information? And that kind of feeds into the next one. Know where and how to get treatment. And this is another way to utilize resources in your community. Take care of your emotional health. And we're going to kind of delve into this in the next slide. But emotional health is like really, really important. Taking care of your emotional health will help you think clearly and react to urgent needs to protect yourself and your family. Plus, sometimes when your emotional health isn't regulated, it can cause sickness. It can make you sicker. So it's important that your emotional health is managed just as well as your physical health. Take breaks from watching, reading, or listening to news stories. The news can be depressing, right? You have enough stuff going on in your life where you don't need anything to add on to the anxiety, the angst, the depression and stuff. So just be mindful of how much of the media that you intake and what you're watching and stuff, because it can be depressing. It can be depressing. Like just in preparation for today's event, I'm trying to get information, I'm trying to study, I'm looking at the news, I'm trying to be well informed. And sometimes it could just seem so sad just when you hear the news and the war stories and everything of the sort. So just be mindful of how much information that you consume and really take care of your body. Like, and this is so important because we understand like all the physical things and everything of the sort, but taking care of your body is like really, really important. So what we call in psychology mindfulness, right, is you taking deep breaths and you're being in the moment, right? Because what depression is like a lot of times is when you ruminate about things that are in the past. A lot of times things in the past you cannot change. Mm-hmm. And a lot of times what anxiety is when you worry about things that are in the future. And if you can't change those things or you can't affect those things, then you're worrying for nothing, but it's having a physiological impact on your body. So taking deep breaths kind of disabuses that stress right there and allows you to be in a moment, let you know that you're present, and lets you know that you're alive. Stretching is so important, right? Because you might not be able to do the exercises that you would normally be able to do some of the things that you normally be able to do, but stretching is still a physical activity that is like really, really important. And it's easy to do even if you have limited space. Like just for instance, I had a client and she came in and she had a house full of kids in a 2-bedroom and the kids were like super duper young. And everybody was like fighting over the television and fighting over the computer because there's minimal resources, minimal space. But one of the things that she could always do was stretch. And that's what I kind of encourage you to do because it's still letting you be physical. And you can stretch to the point where you can still bust a sweat, break a sweat, and still get some semblance of physical exercise. Try to eat healthy. I mean, I think this is really important. Because particularly in our community, sometimes we gravitate towards food that's not nutritious, but it's comforting. But under this circumstance, it's important to emphasize the eating healthy, trying to eat a well-balanced meal, right? Trying to exercise regularly. If you can go for a walk, practice social distancing. And the good thing about going for a walk is that you can walk with a buddy and still have social distance. But while you're keeping social distance, you're still able to breathe. You're still able to work on your emotional self, your mental self. You're still able to do all these things. And sometimes you can walk with a buddy and it can be really therapeutic. I mean, it gives you an opportunity to talk, what's going on in your life, how you're feeling, what's going on. And at the same time, not only are you getting some form of mental and emotional respite, but you're also getting physical exercise. Kind of like Regina said, get plenty of sleep. Sleep is when the body has a chance to recharge itself. Sleep is when the body has a chance to heal itself. Sleep is when the brain is able to remove gunk and kind of clean itself. So sleep is really important. And it can be difficult to get sleep sometimes, particularly when you're depressed or when you're anxious and stuff. But when you start to emphasize sleep, you're able to do it and avoid excessive alcohol and drug use. And we're going to kind of harp on that in the next slide too. So these are like small things that you can kind of do that provide a great result, but don't require a lot of maintenance. Make time to unwind. And this is so important because self-care is essential. Health is wealth. And a lot of times what ends up happening is that you become so anxious and you worry about somebody else, you try to take care of somebody else, that you don't take care of yourself. And make time to connect with others. Like, you don't have to isolate yourself. And what we did was that we created a COVID-19 pamphlet, and we can probably get everybody in here a copy of the COVID-19 pamphlet, which kind of tells you, like, this is how you shelter in place without going crazy. Continue to connect with your community or faith-based organizations. This is so essential. Like, when I was younger and I would visit my grandma, and sometimes, like, she would watch church services, and this is before the advent of, like, the computers and the internets and different things and stuff like that. And what would end up happening is that if an organization wanted to disseminate information into a community before service would start, whether it be on TV, there would be like a little interview where a healthcare professional, mental health care professional, whatever the case may be, would be able to talk to the pastor and discuss what's going on in the information that needs to be disseminated. So it's important that you stay in touch with your faith-based community, because even to this day, like, that's the way that a lot of information is being shared, is by way of the church. So you could go to church for the metaphysical principles, and you can also go to church just to learn more about what's happening in the community, even if you can't be there presently. Stress during an infectious disease outbreak can sometimes cause the following: changes of sleep, difficulty sleeping and concentrating, worsening or chronic health problems, everything of the sort. So one of the things I want to say about this, leading into the next slide, is what the common denominator is that when we don't take care of ourselves, what ends up happening is that we tend to have more chronic stress. And chronic stress is the impetus of many of our healthcare problems. Next slide, please. So how does the COVID-19 kill us? Well, one of the things that we have to be mindful of is the hypothalamic pituitary adrenal axis. So I'm not going to turn this into a biology lesson. I'm going to try not to, but I do want to bring this to everyone's attention. So what the HPA axis is your core fight or flight. So essentially, your fight or flight is when you run into a stressful situation, either you fight or you run away, right? So what your body does is make certain adaptations in order for you to do this. And so what ends up happening is, like, let's say you're walking down a dark alley, you're in a strange city, and you want to survive. And so that angst that you feel when your heart's racing, you become super vigilant, all that stuff, that's the HPA axis. But under chronic stress, the way that it works is, like, your body wants to preserve you at any cost, right? So your body thinks, well, if a perpetrator jumps out and stabs you, I don't want you to bleed to death. So what ends up happening is that your blood vessels constrict. Your body's saying that you need energy either to fight or flight. So instead of getting rid of sugar, it keeps it right there so it's easily accessible, so it's not using energy. Because you're vigilant, like, you're more perceptive of everything that's around you, right? So in a moment, all that stuff's wonderful, right? All that stuff's great. But over a duration of time, what ends up happening, the same way that your blood pressure or your blood vessels constrict, it leads to hypertension. The same way that your body wants to preserve sugar and not waste energy trying to get sugar, like, saluting me right now, but so what ends up happening over a period of time is that you develop diabetes. The way that you're vigilant in that one moment to see what's going on, what ends up happening is that you develop different psychopathology, but most of all, what your body becomes is immunosuppressant. So immunosuppressant means that your body quits fighting diseases. You cannot fight diseases as well because the body's saying, for this moment, I don't want to waste energy trying to fight something. I want to worry about this moment, but over a duration of time, being immunosuppressant makes you more susceptible to different diseases. So we enter COVID-19, right? So and all this stuff is predicated on the development of inflammation, right? So what ends up happening Okay, well, I'll get to that in a little bit. So what ends up happening is that we have angiotensin converting enzyme H2. So where it's located is in the mouth, in the nose. It's located at different places in the body. But the places that we need to worry about today is the mouth, the nose, the lungs, the brains, the kidneys, okay? And so what H2 does is this is the primary medium that gets the COVID-19 and takes it inside of our bodies. And so this is why it's so important that we have to be mindful, like when we touch our face or when we play with our nose or anything of the sort, even though we have allergies. I've been kind of playing my nose a little bit right now, but I washed my hands before we got started. But this is why we have to be so mindful, because what ends up happening is that once the COVID-19 attaches to the ACE, once it goes, or the ACE2 rather, it goes into our body and stuff. And the COVID-19 deactivates ACE2. And what the general responsibility of ACE2 is to manage inflammation, is to manage blood pressure, everything of the sort. So when H2 is not working, that means inflammation, high blood pressure, all that stuff runs rampant. Now, if you think about where I said the location is at, I also said the lungs, right? So if H2 cannot turn off and the analogous protein is angiotensin number 2, right? So angiotensin number 2, like left alone, what it does is that it raises up blood pressure. All this stuff is predicated off chronic stress. It raises blood pressure. It creates inflammation, all that stuff. Then you have ACE2 who can't turn it off. But this is where it becomes interesting in terms of African Americans, is because African Americans tend to have a greater amount of ACE2, probably to help with the more inflammation that we have. But if we get COVID-19, that means that we're ingesting more COVID-19. Mm-hmm. So when you put everything together, that means that COVID-19 aside, we already have higher rates of inflammation. We already have higher rates of hypertension. African Americans over the age of 20, around 42-43% have a varying form of cardiovascular disease. African American over the age of 20, around 15% has a varying form of diabetes, right? This is without COVID-19. So then we put COVID-19 in the mix and we don't have anything to fight inflammation. Inflammation runs rapid, and that's when you start seeing the difficulty with the breathing. You start seeing the heart attacks, you start seeing the strokes, you start seeing everything of the sort and stuff like that, because we don't have something to fight it, but we have a greater level of the COVID-19. And that's what becomes like super duper problematic. Is everybody with me?
Yes.
Okay, I don't want to go off too much on a tangent, but just to take it one step further, as I said, like the kidney is a place where you can find the ACE2. And what sits on top of the kidneys is the adrenal glands. And when the adrenal glands become threatened, or they think it's some sort of chronic stress, or they think anything of sort of stuff, they start pumping, and next thing you know, whatever hypertension that you have, it becomes a little bit worse. It becomes worse. And that's why we have such a greater rate of developing and dying from COVID-19. So those are just things to really be mindful of. So that's why in the previous slide, I was saying it's so important to be able to disabuse stress any opportunity that we get, because we know what's on the other end. Next slide, please. Okay, so where do we go from here? Naturally, social distancing, right? If we can do it, then let's do it. Wearing a mask. Masks save lives. And some of the stuff is like relatively simple for something that's so complex on the previous slide, but these are things that really work. They efficiently work. Managing stress is a big one. And I never say get rid of stress, but it's about managing stress, because it's about, and this is what I tell my patients sometimes, it's about creating a list of the things that you cannot control and the things that you can control, right? And the things that you can control, you take care of. But if you cannot control it, try not to worry about it, because worrying about something that you cannot control ups the stress. And we know how the adverse reaction that stress has towards African Americans. We do. Exercise. Exercise is a wonderful thing because what exercise does is that it really just strengthens the body. I mean, it makes the heart stronger. It makes exercise increases the immune system. Exercise is good for the mental health. And we don't have to be like Olympia or gladiators, anything of the sort. But if there's a way that we could get 30 minutes of exercise in our daily routine, like if we're walking around a block, if we're doing something like that, then that's a really good step in the right direction. And just overall health, it's just really trying to eliminate some of the things that are really not good for us, the smoking, staying up late, alcohol consumption, different things of the sort. Those are some of the things. And also, just real quick, because I don't want to dominate everything, but
We have just a few minutes left.
oh, okay, I'm sorry. Oh, yeah, okay, that's it.
You
sure?
That was awesome.
Yeah, that's it.
Okay.
Thank you so much.
You were supposed to introduce
Oh,
me.
I'm sorry. I'd like to introduce Demetria Jett. She's the administration and health educator for Advocate Wellness.
I'm just being comical. So welcome everybody. My name is Demetria. Just to tell a little bit about myself, I'm a health educator. I work as a lifestyle coach for Trinity Hospital as well as Mercy Hospital. I also work on the board, currently on the board with Advocates for Community Wellness, and I've been serving for 2 years, and it has been a blessing, a real blessing. And I just thank God for Dale for giving me that opportunity. So what we're gonna do at this time, I'm just gonna scroll down. We're just gonna do a quick overview of some of the things that we discussed. We talked about the who of Advocates for Community Wellness. Of course, it's a 501c3 organization with a mission to serve the public through health promotion and education, fitness, nutrition, healthy lifestyle, and healthy lifestyle programs. What we do, we promote health and wellness for all. Why? Because we want to make a difference. We talked a little bit about creating a culture of wealth. Ms. Del Kane herself brought that to the table, and she talked about the holistic approach to wellness, empowerment through education, lifelong learning, leaving a legacy of good health, transformation of your mind, health, healing, and hope in your hands. And then we talked a little bit about the hardest hit. Regina shared with us the CDC stats as well as those individuals that are impacted the most by COVID-19. She also talked about some ways to protect ourselves and gave us a few tips around that as well. And then Dr. Howard brought to our attention some things that we should know about mental health and COVID-19, which was excellent, by the way, Dr. Howard. I'm sure there's going to be some questions. I know I have a few of my own, so I know there's going to be some questions. So we're just going to open the table at this time for any questions and answers. Ms. Lynette, do you want to facilitate that? Let them know what.
Sure.
Raise
Sure. I do see a few panels on the side. If you want, you can always scroll down. If you have a question, please push the reaction button. And, oh no, that's not it. I think there's a way you can raise your hand, right? Let's see. Well, you could put it in the chat, or you can do the reaction with a clap, and then I will call on you. Let's ask the experts. We have an excellent panel here, and Dr. Howard and Ms. Regina, they gave us so many valuable tips and a lot of background as far as how it affects our body. Things, Dr. Howard, that I have never heard on CNN. And I appreciate the way you presented that to us in terms of biologically how it really is affecting us. So please,
Lynette?
okay, Miss Deborah has a question. Go ahead, Miss Deborah.
Hello, can you hear me?
Yes, we can hear you.
Okay, I am truly, truly blessed to have been a part of this conversation. I got on late, but I really thank God for all of you, because this is such wonderful, such great information that our community needs. My question to the doctor is, will he elaborate some more on that airborne theory?
On that what theory?
The airborne.
Yeah. Okay. So, what we're starting to find out a little bit more of is, because it's a process to a certain extent of like what we're learning about COVID-19, and what we're starting to find out is that initially we thought like, hey, you know, if I'm just talking to you and the moment you go your separate way, the moment I go my separate way, then COVID-19 is something that we don't have to worry about. But what research is kind of saying is that, you know, it kind of lingers a little bit in the air. So even after you leave or whatever the case may be, you could walk into somebody else and they've been gone for like 3 or 4 minutes or whatever. Or maybe somebody contaminated or whatever, put their hand on a table, put their hand on a shelf, or wherever someplace you want to put your hand, and that you can contract it like that. So what we're learning is that it sticks around a little bit longer than we anticipated. And so that's why we really have to be mindful of, okay, like, let me wash my hands. Let me really wear a mask. Let me do these preventative measures, because I may be safe, but the person around me, they may not be nearly as cautious as I am, right? So that's why we really have to practice social distancing and stuff like that, because sometimes people say, well, you know what, I don't have it. I don't think they have it. So we're going to be around each other. But you know what, maybe they don't have it, but they touch something and now they're put it in the vicinity of you. Something that I didn't get a chance to mention is that what we're finding is that not only is a disparate rate of African Americans developing it, but usually it's older people who develop it, but it's not so much that older people develop it, but African Americans develop it at a rate that a white person would develop at 70. So if we're thinking that the older person develops it at like 70, an African American who's 60 would have developed at the same rate, which essentially just means that we develop it younger and more aggressive than our white counterparts. Does that answer your question?
Yes, it does.
Okay.
It kind of really,
For
Me,
Regina, we
I just
have a
wanna add this,
question
it
from,
takes us out of our comfort zone.
we have a question. Thank you for the question. We have another question for
Okay, you're
Regina
welcome.
from Dominic Pickens. What are some extra ways to stay safe when living in an apartment complex with people that still have to go to work?
Okay, so are you referring to the living inside the same apartment with the person, or they're living on the same floor as you? Are they housed within the same, are you sharing living quarters, or you're just in the apartment building with the person?
Kind of both.
Okay, because one of the things that, I mean, I personally do, I work in the healthcare field. I'm working in the clinic and I'm coming in contact with patients. Of course, I'm wearing my mask all day long at work. But personally, when I come home, if a person is out in the elements, they are essential workers and they're going out. I personally come home and, I take off my shoes. I sanitize my shoes. I leave them at the front door. A lot of people don't know. It's important also to sanitize your shoes, because as you're walking, around in the elements, you can also pick up things that way. So having the person to remove their shoes, keep them at the door. I keep Lysol and alcohol spray at my front door to sanitize my shoes. And immediately I change my clothes, put my clothes in a separate bag, take them downstairs to my basement so they could be washed, and take a shower. So a lot of people tend to, come home. You want to come home and you want to rest. So you sit down on the sofa, take your shoes off, but not being mindful that if you've been out and exposed, you could have possibly picked up some of the virus and some of the germs, and it could be on the surface of the garments that you're wearing. So if you're coming home, try to avoid coming in contact with anyone. You know, take your shower, take off your clothes, put them in a separate bag, you know, wash them, take them to the laundry room so they're, you know, they're not coming in contact with anyone. Making sure also that you're sanitizing your home, wiping down the doorknobs, wiping down the light switches. Once again, I try not to touch anything when I come home, going straight, you know, to the shower, you know, cleaning, but going back after I come out of the shower and wiping down the doorknobs, the light switches, anything that I have potentially touched after coming inside. So if you're living with a person who is going out, possibly being exposed, you know, I would have them to take those measures when they do come home, you know, leaving your shoes at the door, or if you're taking your shoes off, you know, spraying them down with alcohol or wiping them down with alcohol or Lysol. If you've been around individuals in close contact, you know, if you're working in a healthcare facility, once again, you know, taking those clothes, putting them in the bag, taking them to the laundry, you know, taking your shower, and trying to avoid, you know, touching and coming in contact with anyone or anything until you've officially kind of desanitized yourself.
Perfect. Thank you. Thank you for all the questions. And again, thank you for joining. We know we ran over a little bit, but there's one last thing we would like to do. It'll only take 1 minute. There is a poll that we are about to, ooh, where's the poll? It didn't launch. I think Dale, you might have to launch it.
I just hit the poll, and it didn't come up.
Okay. Well,
We can,
the poll isn't there.
right. But we will be sending you a survey monkey within 2 days. I'm sorry that it was a real cool poll just to assess some feedback from you about the form. But if you could leave a comment in the chat, that would be great. One thing we wanted to know is how many were, and we can do just by raising your hand, how many was here representing an organization? You can just raise your hand up.
Does everyone know how to use that? Do you know how to raise your hand?
I see one hand physically, but there's a button at the bottom and it says reaction all the way to the right. And we just wanted to know how many were coming on as an individual, because we just wanted to target our stakeholders, both organization as well as community residents.
All right.
Yeah. I'm going to turn it back to the next slide. I think we can close out.
Okay.
Okay. I'm just going to do a couple of closing remarks. First, we want you to save the date for our next community forum, our virtual community forum, until we can get back to our live workshops and educational forums. As some of you may know, we put on annual breakfast summit and community resource fair, and so the virtual is substituting that just so that we can stay connected with the community. And so our next one is going to be in August 20th. That date may change, but we will send out an announcement. Everyone who signed up and register would get a invite. And today we did during the business hour, I had so many people who said and expressed that they needed something for after 5. So we may be doing one in the evening for our next forum. Next slide. These are ways that you can get involved and stay involved with our organization. You can host a program. You can host a workshop. and at your, or class series at your church or organization, just reach out to us. I'll be giving you the information afterwards. You can volunteer. We're always looking for volunteers to help us, and you can also donate to help to fund the cause. I just want to say that it takes all stakeholders in society, local government, community-based organization, businesses, funders, community residents, healthcare system, and you to make a positive impact on health for the most vulnerable. And we just want to emphasize that it takes all of us, and it takes all the stakeholders. So we also want to create opportunities and programs and educational workshops and social support groups at the local level, for organizations, for churches, for the workplace as well, to bring wellness to the organization, and to our churches, and to our place of business. We want to walk alongside you and support the discovery of new knowledge through science-based research and education that can cure disease as well as reduce risk factors of chronic condition. We want for you, this is the main number, 773-627-0703. This is our email address, is info@a4cw.org, and our website, a4cw.org. We want you to like us on Facebook, and that's at Advocates for CW. And we want to thank you for tuning in with us, and want you to join us in August. And any comments that you have, please feel free to list them in the chat box. Thank you. This concludes our meeting.
Thank you all.
Thank you all
Thank you so much.
for joining us.
All right, bye-bye.
Thank you.
Thank you.
Thank you.